Now, we had some questions that were brought up prior to this webinar. I know, thank you very much, everyone, for submitting the questions. Let's dive into those, and then after this, we'll dive into the questions that were asked during the webinar. Now, I do want to point out at the top, please go to Surterra and take a look at this webinar form, and it'll be able to get a discount off of a product starting for tomorrow. So nothing wrong with discounts. We're all in favor of that. So Manny, let's dive into a few of these questions. Does the type of arthritis make a difference in what is recommended, meaning terpenes and products? And is there anyone has multiple types? I'm going to kind of jump into this initially. I haven't seen really that there's a lot of difference between the remedies that are suggested for RA or OA, because a lot of it has to do with the fact that what you're trying to address is the inflammation and also the pain, and that's what these terpenes and that's what these strains, or really these cultivars, are really looking at. Now, can you have multiple types? The answer is yes. I know that I had OA for a number of years, especially in my knee joints. I had a knee replacement, and I've also had a rheumatoid arthritis in my thumbs. So I know that they can, again, come into your body in different forms, and it's candidly a pain, and it's something that I've learned to manage using medical cannabis. It's helped quite a bit. You've seen this, haven't you, Manny?
I have, and actually, you're absolutely right. When it comes to the terpenes, there's not much of a difference, if any. However, there may be a difference in the products between OA and RA, simply because RA is going to be more systematic. It can actually affect the organs as well, where OA is going to usually be more localized. And because of that, where I would recommend the balm for OA, because you're probably just going to use it for one knee and maybe another joint. RA is different. It may be a little bit too expensive because you may have multiple joints that are hurting, and one canister may not last as long as it would for somebody with OA. So definitely, to your point, as the recommendations and the consultations come in, let's have that discussion, see which one. If it's multiple, we'll dive into those products. But you can use topical with the ingestion as well. You can have the sublingual tinctures or orals or edibles, which is preferred for any arthritis, and then you can use topicals at the same time. So yes, it can affect different products, but the terpene profile should be about the same.
Sure. So the question of weigh the benefits of CBD versus THC percentage for arthritis and stenosis. Is there a number for both to start in amounts? Well, first of all, using medical cannabis with both CBD and THC is very important, because they work together and create what they call the entourage effect. By working together, they work better than individually. Now, what is the percentage to start? I think it really depends on your body and your dosing, because every person's body is different. Manny, what have you seen in the past? I think it's important that people understand their dosing, their therapeutic dosing level. And this is where it answers that question of what percentage, right?
Yes, absolutely. And I'll refer back to one of your slides when you were talking about the endocannabinoid system, or the ECS, and the different CB1 and CB2 receptors, and why is so important. As it was mentioned in the slide, your CB1 receptors are primarily in your spinal cord and in your brain, and reacts more with THC, whereas your CB2 receptors are more peripheral, which reacts more with CBD, which is why it's so important to get that CBD regimen in there to help with that inflammation, to get to those joints, to help with that pain and that inflammation, while the THC kind of distracts you from it and kind of pokes at it, because THC is an anti-inflammatory as well. But since there's not as many CB1 receptors in your peripherals, it doesn't help as much as the CBD does. So one-to-ones are always going to be the most beneficial part, but that's just the cannabinoids. Again, to one of your slides, the terpenes is what really drives that bus and which way is going to be most beneficial.
Sure. Now, the other part of this question is there what is the starting amounts? I recommend, if you're going to start, you start with a 1-to-1.
Yes, and then you can always microdose with a tincture, 0.25 and above in quarter amounts. And then we have our wanna chews, which are one of the only chews that are homogenized. So you can cut them in half or in quarters and start off at 2.5 all the way up to a 10 on one single chew.
Mm-hmm. And that leads into our next question, which is, how can I microdose with gummies and tinctures? What are the amounts to start with? Well, first of all, let's start with gummies. The nice part about the Wana products is you can cut them into quarters and halves. I recommend when you're looking at, especially if you're new to medical cannabis, go low and go slow. I'd take that one gummy and I cut it into quarters. Try that quarter in the morning, maybe try it the next day or in that evening. Find out if you're getting any relief or if you feel anything. You may not feel anything right away because you're taking a small amount, but it's better than taking 3 gummies and having a negative reaction. It's important that you be able to go low and go slow. So I would say cut the gummy at least in half, maybe even quarters. And I think for tinctures, maybe starting at the bottom end of the eyedropper, maybe 0.25 milliliters or the first line that's on the tincture dropper. Is that a safe place to start, Manny?
That's completely accurate. The only thing I would add in there is whenever you're using orals, sublinguals, or edibles, you want to make sure to have a little something in your stomach if possible, a small snack right before, or if you know you're about to have a big meal, have it just before a big meal. Your your gut actually plays a big role in how your body's going to absorb it and how long it takes to absorb it, so you get the effect you're looking for.
Yeah, and microdosing is great. I know as an athlete, I know when I was playing professional sports, we used to eat literally sometimes 4 to 7 times a day, eat a little bit during the day rather than big meals. Just helps your body absorb it and really provides the energy during the day. Same thing with cannabis. And if you're going to be microdosing gummies, cut them into quarters. You know, every couple hours, try another one. It's probably going to be the best way to be able to introduce yourself to the product and get your maximum amount of relief. The question becomes, which edibles would best target age-related degenerative arthritis? Manny, you want to take that one? I know Wana has some great products, right?
Absolutely. So we have right now the 2-to-1 yuzu, which are a high CBD, and the 1-to-1 strawberry lemonade, which are great as far as edibles. And then we also have the balm, which is what I use. I have something similar, but of the spine. So I have assistance in getting the balm rubbed up and down my spine. And then I use the 1-to-1 soothe or the 1-to-1 wana strawberry lemonade just because of my tolerance. But the yuzu taste great. They work great. For me, I tried them just because I like to have that knowledge on what I'm recommending, especially
Sure.
since I'm a patient. But yeah, you could go topical, oral, and you could even use inhalants such as vapes. We have 1-to-1 vapes as well. The only caveat I would put out is that when you're vaping 1-to-1s, you're not getting as much bioavailability of the CBD to stay within the system. So it's fast in and it's also fast out. Whereas when you preload or you load up with orals, edibles, or sublinguals, it stays in your system a while. So the real importance of that is, like THC, as we all know, when you use high THC products, yes, you're feeling great. You're distracted from your ailments. However, once that wears off, all your ailments come flooding back. Right. CBD works different. Since it preloads, it takes a while to go in. It takes a while for it to get out. So you're pretty safe in that respect.
Well, I know that one of the things I really like is you have your 2-to-1 wana, which works great for that, and your balm. You know, that helps quite a bit. We'll talk a little bit more about it with some of the other questions coming in later on. What role does CBD play in the pain management component of RA and PSA? Inflammation in your body causes pain. And in many cases, if you reduce the inflammation, it reduces the pain. And in fact, a lot of people have said that CBD is great as a pain relief. And in reality, there isn't a lot of THC in CBD. The THC is really what helps with the pain relief. But relieving that inflammation takes away a lot of that pain. And so that's where the perception that CBD is really helping quite a bit. I would say the role is the reduction of inflammation. That is your number one enemy when it comes to arthritis. If you can get that inflammation down, you'll be getting the pain down. Your thoughts, Manny?
I agree. I think the issue that most may have is that they're in pain, so they want that rapid relief, and that's where the THC comes into play. And so CBD doesn't necessarily always get a fair shake. Again, remember, you have to take it for a while. You should get some relief initially, but the more you use it, the more benefit you're going to get from it.
Sure.
The other role in that is that where is the CBD sourced from? Are you getting it from a dispensary or are you getting it over the counter? And that goes into the hemp role. Using flower or product that's under 0.3% by definition of the federal government doesn't necessarily provide the best medicinal taken orally or topically. And there's no regulation on the labeling laws for that. So always go to your dispensary. You could get a certificate of analysis. You can see exactly what's in the product and why it's beneficial, more importantly.
That's really important. Next question is one I can really relate to. It says, I have bad flare-ups occasionally. What do you recommend for these? What I have found is and I'm going to follow Manny's advice, by being able to have CBD in my body by every day using a CBD product, especially like the 2-to-1 Wana, and or more importantly, some of the tincture drops, it helps build up the CBD in your body, which helps reduce the inflammation. Now, when I get a flare up, I found the two things that help me quite a bit are, first of all, the balm, and number two is the Wana, is the 2-to-1 Wana gummy. Your thoughts, Manny?
Yeah, the yuzu wana are great for that. And specifically when you're using gummies, chocolates, or sublinguals, the onset is usually within 30 to 45 minutes. So for a flare up, it may not always be the best depending on your diet. So that's where the 1-to-1 vapes come into play. We have the 1-to-1 Soothe. We have a 1-to-1 Flaming Cherries, which is a cartridge, which is great for the daytime. And then we have a 1-to-1 Stupor Glue cartridge that's good for the afternoon, evening times as well for those type of flare-ups. But always remember, if you're having that flare-up, that may mean that you're depleted on your CBD within your system. Go get those Wana chews, go get those edibles or something, so we could rebuild up that CBD for your ECS, your
And I know I
endocannabinoid
grabbed
system.
the balm. I put on
Mhm.
some, it definitely helps quite a bit. I know that I do a lot of keyboard work. I'm behind the computer quite a bit, almost all day. And I get a lot of flare-ups that are actually in the joints that are just right behind my thumb. And I find that it helps quite a bit. In fact, it relieves, takes all the pain away usually within 5 to 10 minutes.
I haven't had anybody come back and say that it hasn't benefited them in some type of way.
Right.
Not always a 10 to a 4 or 3, but usually you get some benefit where you can get mobility and get some relief.
Right, right. And when you start reducing the inflammation, the pain starts going away, and that's the important part to understand. It says rheumatoid arthritis causes severe pain and loss of sleep. What are the best strategies to combat this and protect my lungs? Well, first of all, let's talk about lung protection, because if you roll a joint and you smoke it, that's burnt material. Anytime you put burnt material into your lungs, it's really not good for you. The best way of putting it. Now, medical cannabis is not as bad as tobacco, doesn't have as many carcinogens in it, but it is burnt material. My recommendation is use a dry herb vaporizer. These are devices that you put the flower into a little cup. That cup is then steamed, essentially. You can actually choose the temperature of that particular device, and then you get the benefit of the flower without the negative burnt material going into your lungs. So that's how you protect your lungs. But I think the best way to protect your young lungs is not to use any vaporized product at all. Stick with the tinctures, balms, and also the gummies. Your thoughts, Manny?
Absolutely. If you just to touch base on the inhalation part, if you are going to inhale anything, one of the myths that I'm finding out is not to hold your breath. That's actually just going to irritate your lungs more, create that heavy feeling, a little bit of a panic feeling. So don't hold your breath. Otherwise, we do have, like you said, the patch or the balm, the tinctures and patches as well, which I forgot to mention, is a very great way to actually combat that. You could put it on the small of your wrist, top of your foot. Thin veiny area is preferred, so we could get a little bit of that medicine in you. It's a micro dose of around 2.5 milligrams, give or take, and it lasts about 7 to 12 hours, depending on your mobility and how much you're moving around. Great for sleep, and another product that's really good for that is Relief. One that I left out on our slideshow. Relief is great for pain, anxiety, and sleep. It's a 1-to-9 ratio. So it's 1 part CBD, 9 parts THC, which is probably why I left it off, because I want to get that CBD in there. But there's also a 1-to-9 Dream that I don't want you to get confused with. That one's more for if you have a racing mind, not so much pain. And that's just because of the terpene profiles that are in it.
Yeah, by having a different terpene profile, and this goes back to the concept of cultivars. A cultivar is built for a particular purpose, and in the case of Dream, you put a terpene profile in it that helps you sleep. I know Dream is a great tincture to help you sleep. I've also found that when you take a look at edible products, whether they're gummies, I'm a chocoholic, so I do my evening chocolates. They'll give me that 6 to 10 hours of relief that I need during the night. The problem with tincture drops is they typically last 4 to 6 hours. So you can wake up in the middle of the night because they've fundamentally wore off. So I think the best way to manage sleep is with some sort of a gummy, or some sort of an edible or oral product. I think the best way to manage pain is to take a look at not only what you can do with respect to tinctures and balm, but I'd also pay attention to the balm. I really am a big fan of topicals. They may only last an hour or two, but they give you almost immediate relief.
And then on top of that, we also have the Theragels, which makes up the difference for the tinctures. So the Theragels, you get about 90% bioavailability, whereas the tinctures, you get 60%, or give or take. So the Theragels will be most beneficial at night to get you through the night, if the tinctures aren't doing it for you.
Sure. No, that's great. That's great. What are the best terpenes and combination thereof for pain relief? What delivery method works best? And this is related to another question of what strains and products are recommended for nerve pain. Manny, that's right up your alley.
Absolutely. As it was stated on the previous slide, my favorite is always caryophyllene. That's your natural analgesic. It reacts the best with not just your CB1 or CB2 receptors, but it acts as a cannabinoid with your CB2 receptors. Then you have myrcene, then linalool, and then terpineol, which are my favorites. Limonene would be thrown in there for the daytime. What strains products are recommended for nerve pain? Again, Soothe 1-to-1, Arowana Chews Strawberry Lemonade, which is a 1-to-1, the Yuzu, which is a 2-to-1. And for those who are not familiar with Yuzu, I find it to be some cross between like an orange and maybe a lemon, but not so bitter. It was actually really, really pleasurable to experience. So those are my top 3 picks for as far as products are concerned.
But they taste great. That's the good news.
Yes.
That's the bad news. Don't eat them like Skittles. Okay. This is not candy. I know that there's some people that just they like to down them. And unfortunately, you could take too much THC, which gets to the next question. What's the maximum dose of THC that is safe? First, let's make something very, very clear. No one has ever died from using cannabis, whether recreationally or medically. There has been no recorded deaths by all the agencies that follow this, whether it's the CDC or World Health Organization that's out there. So when you say safe, I'm going to use, first of all, the first safety factor. This is not like an opioid that you could die. You're not going to die from this. Now, what are you going to experience? Some people, depending on your body and who you are, you basically, if they call it, when you get high, you may lose your balance, which is in the case of senior citizens not good, or I guess for anybody it's not good. You also can get an effect that you just don't feel good, put it that way. But I would say the maximum dose really depends on you, and that's why finding out what your therapeutic dose for THC is really important. Go low and go slow. Find out, you'll begin to feel good, then and just keep increasing that dosage. And then when you'll at one point, by increasing the dosage, one day you won't feel as good, and you'll say, wait a minute, I don't feel as good as I did yesterday. Back down. You've reached your level. You're starting to get to that biphasic effect, and you're starting to now bring back the negative effects. So go back to that level that's really there. Each person's level is different, and that's what makes it difficult to be able to answer this question. And by the way, I'm going to throw a side note in there. In talking to a lot of doctors and pharma companies, they have exactly the same problem. When the doctor says, take 2 pills and call me in the morning, they're giving you the lowest dose that's recommended. They're hoping like hell it works. And if it doesn't work, you got to call the doctor and get another prescription. And what I'm trying to point out is that in this particular case with medical cannabis, you can try, instead of 0.125 milliliters of tincture drop, you can increase that to maybe 0.25 or a quarter of the actual drop itself. Much easier to look at or to administer, and much easier to manage. Your thoughts, Manny?
I completely agree. Just some side notes on my behalf that I figured out throughout some of my studies and experience is that the average dose, I believe, is somewhere between 7 to 12 milligrams, which is why most of dispensaries, including Surterra, has products at 5 milligrams or 10 milligram increments. And then again, with the Wana Chews and our mints, you can microdose at 2.5 up to 10 milligrams. So I agree with that, but on average, from what I've seen, don't quote me on that, is average is 7 to 12. Right. And then a little bit back to what you mentioned about the Skittles part, and what I found works for me, so I don't eat more gummies or chews, particularly the Wanas, is even though I know I need a whole chew for my particular circumstances, I would cut it up in quarters and take 1 quarter and then take another quarter, because it felt like I was getting more. And then the other benefit to that is I don't necessarily just chew them up. I kind of administer them like a lozenge. So that way I get the most sublingual absorption as possible before swallowing it. Because as soon as the terpenes hit the stomach acids, they're done. There's
Right.
no more terpenes. They're the most volatile. So it's more just the cannabinoids that are taking effect from that point.
That's a good point. I think a lot of people don't realize that you can take the chews or anything that you take orally and just basically suck on it for a while.
Hmm.
That really is really, really, it's a good tip. In fact, it's a great tip that I think is very important to understand. Next question is one I can really relate to. What's best for my acute arthritis in my thumb joint? Cortisone shots don't help. Listen, I went through, as a professional athlete, me and my doctor got to know each other on cortisone shots. And when I finally, at the end of my career, started getting into medical cannabis and was able to not do that, I found it helped tremendously. It was night and day. Cannabis was night and day over cortisone with respect to helping with pain relief. Now, in my particular case, what I found is I found a combination of the tinctures and I found a combination of the rubs really make a difference. Your thoughts, Manny?
I agree. To that point on how cannabis is so different, I like to explain it as cannabis plays differently on the playground or in a different playground as far as receptors are concerned. So the same thing with people who are trying to wean off opioids, who suggest that they're on such a high dose of opioids, they're going to need such a high dose of cannabis to wean off. And typically that's not the case. Usually, if you're using a lot of pharmaceuticals, you don't need as much cannabis to wean off or otherwise, simply because of the way cannabis reacts with the body differently as a whole for the whole homeostasis, rather than a synthetic that's meant for one purpose or two or three purposes with side effects. So to that point, yes, cannabis is significantly different. Try the topicals, and as well as some orals or inhalants in combination or in tandem, so that way you get the full benefit.
Yeah, and when you get that flare up in your thumb, really go over and again, the bombs come into play. They help quite a bit. I think people don't realize that you have immediate relief that comes into play, as well as potentially a vape can help with the pain as well. It's really there. Next question is a good one. Recommendations for osteoarthritis with a ruptured ACL of right knee, currently under orthopedic surgeon. I've had my left and my right knees replaced. Welcome to years of walking in golf courses. And I have to tell you, I went through a lot of work with orthopedic surgeon. My orthopedic surgeon and I worked with my last knee operation. I actually used medical cannabis as opposed to pharma drugs for pain relief after the surgery. And by the way, I'm going to be doing a video on that because I know I've had a lot of requests on what's the best way to do that. So stay tuned in the next quarter. You'll see a video coming out on that, but on our YouTube channel. What I'm trying to point out is that the same products that we're recommending for arthritis in general, I would say in the case of a ruptured ACL, pay attention to a higher CBD, C8 and lower THC product. I know that when I first had my knee replacement, I was going the other way. I was going with high CBD, high THC, low CBD. And then one day, about 3 weeks after the operation, I ran out of that product, and I only had CBD products, a high CBD product available. So I tried that because I couldn't go to the store at 10 o'clock at night, and I found out it worked. I found out that reducing that inflammation is really the key to be able to reducing a lot of the pain. It was kind of a hard fought lesson, but it's something that I really paid attention to, and I pay attention to today. I would say really pay attention to reducing your inflammation, and again, finding out which products that work for you through your dosing regime. Thoughts, Manny?
Completely agree. And the risk of sounding like a broken record, some of the same products would apply here, particularly those topicals, the balm, maybe even the lotion to help with the muscle tension on the back end, throughout the calf and your upper thighs and hamstrings.
Yeah, I know what's the best method of application for osteoarthritis. Again, this goes back to what you were just saying. All of you, again, being your broken record, it goes back to a lot of the cases of really, in many cases, it's what you like to take. You know, if you are okay with tinctures, great. If you like edibles, great. If you like vapes, great. Don't do something that you're not going to want to do. Don't be forced to take something that you're not going to really enjoy. If you are good into edibles, that's great. If you're good into tinctures, that's great. I have found that if you put on a balm and it gets rid of the pain immediately, it's almost like Pavlov's dog. You come right back to it. You know, it's kind of like that really works. So first, I'd say the first thing to do is stick with what we were recommending, but also find out what works for you. And I would do that by, again, trying again, the vapes, the edibles, the creams. Your thoughts, Manny?
I agree. I would always go with the topical and then at least one form of other route of administration. I would like to prefer to recommend oral, sublingual, or edibles, but even vapes would be beneficial for the longevity, for a long lasting effect rather than having to apply a topical every 2 or 3 hours.
Right. Can cannabis replace medications like Celebrex? If so, what is the recommended dosage? Well, I'm going to sound like a broken record and say you've got to find out what dosage really works for you. And I think that's important that and by the way, we will be doing a dosing webinar, and there is dosing videos on our YouTube channel, so please check them out. But can it replace it? The answer is yes. My most favorite aunt had arthritis, terrible case of arthritis. I have a patient that's from the villages that really couldn't even open up her hand. That's how bad it was. And a lot of the pharma medications didn't work, as well as my mechanic, the gentleman who works on my car, had problems with arthritis. And what we found out was by using a high CBD, low THC cannabis product, it really helped quite a bit. Now, in almost all those cases, it didn't work immediately. Like you don't take it and in that afternoon it works. As Manny was mentioning, you need to build that CBD up in your body. Give it a week or two, and you'll find amazing relief that comes out of this. In one case, we had the lady in the villages had her hand was actually clenched closed. And after about 3 weeks, it began to open up. Obviously, when you have a clenched hand, you can't eat. It's hard to use utensils. It's hard to do remote controls. And she really got her life back. It really helped her not only being able to have her life back, but also emotionally with all the stress and relief from that. Thoughts, Manny, on that?
Yes, using those topicals, although, like I said, I recommend them every time, it is actually a shortcut to circumvent the ECS or the endocannabinoid system to get that immediate relief. And what you'll do is if you only use a topical, you'll always constantly use it constantly over and over. Whereas if you start ingesting CBD, then you'll notice that you may not have to use the topical as much because now you're getting that homeostasis throughout your body.
Right.
And that inflammation has dropped significantly. Hence, you got more mobility, better spasticity, excuse me, and you'll start feeling better.
Yeah, that's really great. So this finishes a number of our questions that we had prior to the webinar. Let's talk about live questions. Judith asked the question, do the patches come in sativa, hybrid, and indica, and does it matter? Manny, that's right up your alley.
Yeah, absolutely. So we do have patches in our wellness line, such as Zen, which is a sativa, Relief, which is going to be more of an indica, and so forth. So our wellness line is that way. However, the doses that you receive is so minute that you may not necessarily feel the effects. And if you do, you might become tolerable to them quite rapidly because of the fact that it's such a micro dose. What does matter is the cannabinoids content. So if it's a one-to-one, having that more CBD, or if it has terpene profiles, again, like the Soothe patch is amazing specifically for that inflammation and pain, particularly because of its terpene profile and cannabinoid content.
So it does matter. And
Yes.
This is where you talk to your bud tender. And I'm going to go back to something we mentioned before. Get a consultation. That's really going to help you quite a bit in taking a look at what's there. Jay asked a question, a great question. Thank you very much. Will you be doing a vertigo webinar? I hadn't thought about it, but I'll put that on our list and we'll definitely consider it. If we do one, we'll definitely let you know. That's a good topic to talk about, and something we should really address. It just wasn't on our list initially, but yeah, it's a good topic. Thank you very much for bringing it up. Lori asked a good question. Have you discontinued the Tranquil product?
That's an excellent question. That's one of my favorite CBD products. To answer your question, no, we have not. What's going on is we have a lot of new things going on, and in order to process all that, is to hurry up and weight gain with DOH approval for branding and otherwise. So no, we have not discontinued it. We're hoping to get it back soon. Feel free to call in to re-ask that question. Now that it's been here, I'm going to send that up and make sure everybody knows that we need to be prepared for that because we all want it back as well. Thank you, Laura.
Sure. And I think getting those let's just say those approvals don't come as fast as you'd like to have them done. Welcome to dealing with the OMMU, but it is coming. Why would orals not help me, but inhalation does? I think this is a lot has to do with the onset time. Your thoughts, Manny?
Yeah, so the first thing, and again, I'm not a physician by any means, but the first thing I would ask is, what is your diet like? because your gut plays a huge role in that, in absorption. If it's sublingual, if it's capsules or theragels, if it's edibles, how long are you keeping it in your mouth? So there's a lot of variables that play into that. However, scientifically, it could also be that your body just doesn't produce or convert the delta 9 into 11 hydroxy THC like other bodies do. So there's a lot of variations that go into there. But if it's just orals like capsules and otherwise, I would try sublinguals, because that's going to be absorbed through your mucus cavity under your tongue and in your mouth.
A different way of absorbing it into your body.
Correct. So that might play a different role. But again, come and get that consultation. We could ask more questions to dissect what's really going on, John.
Every person's body is different, and get that consultation, because I think it'll help you quite a bit. But the other thing is wait. Have patience. I call it just be very, very careful. Wait and be careful. Sheila, you asked a question that it says, why is it so expensive in Florida to get and maintain a THC CBD license? First of all, I try to stay away from politics on this program, and I really don't want to get into politics. But I can just tell you that the representatives that we have in Tallahassee, most of which represent one particular party, I just don't want medical cannabis, even though we voted for it, even though we wanted for it, even though the people have asked for it. They're still doing everything they possibly can to really slow the market down and really restrict it. Why does the license cost what it does? You can thank Rick Scott, and just remember that at the ballot box next November. He was the one who made sure, and he specifically wanted it to cost so much nobody would get a license. That's why you have to get a recommendation in the first half of the year and a recommendation in the second half of the year. So you have to visit a doctor twice. And that was brought up in many cases. A lot of times we wanted to be able to drop the second half of the year, because in my case, I have herniated discs in my neck and they aren't going to go away. And the excuse was, well, we want to make sure your doctor's helping you with dosing. Well, that's a flimsy excuse. In many cases, it just had to do with the fact they wanted to drive up the business. And the doctors will help you with your dosing. The doctors will be there for you. And that's really something that's important. But I think that it really has to do with more politics than anything else. And I would say the only thing I'd recommend is remember that at the ballot box, because in many cases, you're voting back in the people that are really affecting your wallet. And I think that's something to pay attention to. I'm not going to ask you for comments, Manny, because this is more of a political question, but I feel very strongly about it. I really think that politicians work for you. You don't work for the politicians. And I think they need to remember that. And we need to have them understand that, especially with elections coming up. Does THC have anti-inflammatory properties or only in CBD? THC does have anti-inflammatory properties, but it's not as effective as CBD. Your thoughts, Manny?
Yeah, I think I was speaking on that on another question. CBD reacts more with your CB2 receptors, again, more in your peripherals, your arms, your legs, and throughout the body, as well as the spine and your brain. Whereas THC reacts with your CB1 receptors. Again, they are in your peripherals, just not as abundantly. They're more abundant in the spine and in the brain. So therefore, CBD works better for anti-inflammatory properties rather than just THC alone.
Mm-hmm. Really. And the last question that comes up here is, can you microdose with Heights gummies?
Great question. And Heights gummies are not necessarily homogenized. So whenever I'm talking to patients who come in, I let them know, you don't necessarily, especially if they've already done it. A lot of times they'll come in and say, hey, I had a half one night and it was perfect. And then another night I tried a half and it was too much. And then I tried another half and it was nothing. And it's because you don't know where that medicine's at in that gummy. It's meant to be taken as a whole, not to be cut in half or in quarters. Right now, as far as I know, Wana is the only one in the Florida market that you can do that with. Please don't quote me on that, but we're proud to have them. And please come in and ask them. We'll go over all that information with you there as well.
Great. Well, we had a lot of information tonight. We answered a lot of questions. And boy, first of all, I want to thank everyone for the questions and for joining us tonight. This is a very important topic. And I want to point out that after this webinar tomorrow, you'll receive an email, or next day or two, you receive an email that has a link to this video, as well as the video that we played during the webinar. It'll give you a link to this presentation in a flipbook format. and a lot of the resources that are out there. For example, the link for a Surterra discount that's out there. And if you're looking for a medical marijuana card, I would recommend Medical Marijuana Treatment Clinics of Florida. They have 22 clinics here in Florida, and they're located. They have a high quality of standard of quality, to be able to help patients, and I really like them. Naturally, I favor Surterra products, not just because you're a sponsor. I've been a fan of Surterra for a long time, and it's something that I like. The way you have your ratioed products, I like your consultations, and I like the approach that you take. My Botanical Wellness is a site we have if you're looking for just CBD products, because the dispensaries really don't carry CBD only products, and it's something where you can get your products that are there. Why this particular site? Because they recommend, we have physicians that look at these products and make sure they're recommended, because it's an unregulated market. And naturally, please go to our YouTube channel and check out a lot of the information that is really out there. Now, I don't want to skip out on something. I know that Forrest, you had a giveaway, right?
We do have a giveaway. So a couple of things. Just wanted to reiterate that inside the chat, there is a link to get a $10 coupon. The coupon will show up tomorrow, and it'll be valid for 1 week. You do have to be a Florida medical marijuana patient, and then also have our app downloaded, because that's how we're going to deliver it. We'd also like to give a free product out tonight. Same situation. We're going to deliver that free product through our app. And so you will need to have our app downloaded. But what I'm looking for in the chat is I'm looking for 3 terpenes that Manny listed out that are the best terpenes for arthritis. It could be any of the 3. I need all 3 of them, plus your name and your email in the chat. And the first person that can send us that, we're going to set you up with a free product as well.
Great, that's great. Well, listen, we've covered a lot of topics and a lot of information. I am really happy that you joined us, and thank you very much. I know we've gone out, we've spent a long time going over a lot of different topics. Hopefully, you'll be able to be helped. Our goal of this webinar series is just to help people get their life back. And if just one person watches this webinar and they get their life back, then we've accomplished what we wanted to accomplish. But I think hopefully more people than that, including you, can hopefully benefit from this. I want to thank, I'm going to get some final comments from Manny and from Forrest. But before I do that, I want to thank a couple people in the background that have really made this happen. Leah and Lee, you can see them handling the comments and things. They do all our production work. They may not be on the screen, but they're an important part of this whole thing. And Alyssa Katera, who's the lady who came up with the idea of this conference or this webinar series, really something that's there. Before we sign off, Manny, you have any final comments and thoughts?
Sure. I'd just like to say thank you for having me. It's always a pleasure to be here and to provide that assistance. And I just want to let everybody know, although I am introduced as the Pensacola manager, anybody at any Surterra, any of our guys will be more than happy to assist you. We're very passionate and empathetic to what we do. So please take the time to come in and ask those questions. Don't feel rushed. We're here to assist you. As always, thank you, and please stay safe out there.
Right. Forrest, any thoughts you have?
I really appreciate that you just said that, Manny, because I was thinking the same thing. Manny is obviously great and on this call, but we have 45 stores throughout the state, and everybody really works like this, and this is how we as a company operate. And so definitely come in, talk to your guys, talk to the managers, have a consultation. We are not just here to sell the product, but we really want to help anything that we can. So
And
really
not only sign up for the app, but sign up for your emails. I know you send out emails on a regular basis. I'm kind of the cannabis dispensary whisperer and kind of look at what's out there. And so I miss.
Well, we talk about costs on things too. So any way that people can save on costs, right?
Yeah, exactly. And you guys do a great job of really putting that out there. And I want to thank everybody for that. So thank you very much. Our next webinar is coming up. It's going to be sleep at the end of the month. And it's very important. We have Dr. Greg Holt, who's going to join us for that. Thank you for joining us. And Manny and Forrest, thank you for your contribution. We really appreciate it. Have a good evening and have a good weekend.